Number 15. Invasion of the Canadian Body Snatchers. David Tate and Leon Swanson are two close friends who were born 3 days apart at the Norway House Hospital in Manitoba, Canada. As it turns out, they share a lot more in common than just a close bond. A DNA test revealed that David belonged to Leon's mother and vice versa. Somehow, the two had accidentally been switched at birth and did not discover the mistake until they were in their early 40s.
They want answers. They want answers. They want answers.
I don't know what to say, so...
For the past 4 decades, they were raised by each other's parents. Amazingly, this is the second case where the Norway House Hospital has sent the wrong newborn home with parents. Another 2 people have been identified as being switched at around the same time, and an ongoing investigation is looking at other possible instances too. Number 14. Gone, but not forgotten. The University of Washington Medical Center does a pretty good job with their surgeries, until they get to the very end. That's when they sometimes forget to clean up after themselves. Just ask Donald Church. In 2000, he was 49 years old when he had a 13-pound tumor removed from his stomach. Shortly afterwards, the man felt excruciating pain all throughout the day and night. The pain would start in his abdomen and then move to his chest as the week went on. It was so bad that he would often lay on the floor and cry. He tried to go back to his job as a janitor and live life as best he could. When he went to get a monthly examination, the University of Washington Medical Center surgeons said that his traveling pains were normal. As it turns out, they were absolutely wrong. Surgeon Dr. David Bird had accidentally left a thin metal device called a retractor inside of him. This metal object kind of resembles a ruler. It's about 2 inches wide and it's used during the last step to protect organs from the needle while they are closing up the wound.
This is what it looks like.
That's just unbelievable.
By the time they had finally figured out their mistake, nearly 2 full months of sheer agony had passed. He has since received a $100,000 settlement from the University of Washington. Prior to this case, at least 4 other patients at the same hospital have had surgical instruments accidentally left inside of them. Number 13. The Waiting Tomb. A 49-year-old woman with paranoid schizophrenia named Esmin Green is waiting for admission in the Kings County Hospital Center in Brooklyn. She was taken to the hospital against her will after paramedic technicians found her in the middle of a psychotic breakdown. They were only trying to help her at the time by committing her, but little did they know that this decision would result in her death. When she gets to the hospital, the staff lets Esmin sit in the waiting room for a full 24 hours until she finally collapses out of her chair at 5:30 in the morning. Amazingly, medical workers continue to walk right by her, paying absolutely no attention to the body that's lying face down on the floor and in obvious need of help. A nurse finally takes her pulse 1 hour later. She doesn't find one. The Kings County Hospital had let Esmin Green sit in the hospital for so long that she died of blood clots. This can happen from long periods of inactivity, and traveled all the way up her body until they reached her lungs. The city of New York accepted full responsibility for her death and paid $2 million to her family. Number 12. Urine trouble. When 14-year-old Christina Atkins started to feel seriously ill, her mother took her to the BB Hospital in Louis, Delaware. Since they weren't exactly sure what was wrong, the nurse asked the high school freshman to take a small cup to the bathroom for a urine sample. It would be the last thing she ever did. From inside of the bathroom, Christina's body hit the floor loud enough to stop everyone who heard it. They rushed to open the door, but it's been locked. They went to get the keys at the nurse's station, but they weren't there. A janitor ran deeper into the hospital to find a spare set. Meanwhile, on the other side of the door, Christina's terrified mother listens to her daughter's labored breathing as she slips into cardiac arrest on the bathroom floor. The janitor returns empty-handed. Nobody knows where the spare set is. The staff is using pens, paper clips, and pins to try and pick the lock, but to no avail. At this point, Christina's mother is sickened by the staff's incompetence and is calling for someone to dial 911, completely aware that she is already in the waiting room of an hospital. A full 10 minutes pass before a security guard is able to get the door open. When the mother sees Christina, she says that her daughter's eyes were looking straight through her. She was airlifted to another hospital and died 2 days later of toxic shock. The 10 minutes that the BB hospital staff spent fumbling with the door could have very well ended her life. They have since settled out of court for an unknown sum. Number 11. The wrong button. When Ursula Sampson went to the Good Hope Hospital in Birmingham, England, the doctors found she had a simple case of pneumonia. She was hooked up to a bag of potassium chloride to help her fight the lung infection. Sounds simple enough, right? Well, the nurse was supposed to give him 10 milliliters over a course of 5 hours. Instead, she accidentally hits the wrong button and pumps Ursula full of 100 milliliters of potassium chloride over the course of 1 hour, 5 times the normal dosage. Overdose symptoms from potassium chloride include feeling a heaviness in your limbs, confusion, seizures, and a slowed heartbeat. While it's impossible to know how many of these symptoms Ursula felt, she had nonetheless died of heart problems by the time she was checked on again. The first nurse was supposed to have been watched by a second nurse to prevent this from happening. Number 10. Close enough. If you are ever unfortunate enough to ever need brain surgery, you might not want to go to Rhode Island Hospital. That's because they just can't seem to stop doing brain surgeries on the wrong area of their patients' heads. In fact, they managed to make the same general mistake 3 times in 2007. In February of that year, a Rhode Island hospital neurosurgeon and a nurse are busy working on a patient when they release that they've made a terrible mistake. The medical device they're installing is called a drain, and it's meant to remove excess blood from the brain as needed. They do everything well, except for one thing. They accidentally install the brain drain on the wrong side of the patient's head. Later, the doctor and the nurse both confessed that they had no idea how to properly follow the hospital's checklist before they attempted this procedure. That July, a different Rhode Island hospital surgeon decides that he doesn't need to write down important information on his patient's charts, like which side of a patient's head needs to be operated on. The nurse questioned the surgeon about leaving this area of the form blank, but since he had been performing brain surgeries for decades, he felt experienced enough to not make such a rookie mistake. The nurse even asked him a second time during surgery if he was sure that they were working on the correct side, and he assured her that he was. By the time he had realized he was incorrect, however, he had already cut their patient's scalp all the way to the bone. Number 9. No extra charge. In 1995, a Tampa Bay, Florida surgeon named Rolando Sanchez enters the surgery room at the University Community Hospital. Today's patient is a 51-year-old man named Willie King, who has diabetes and is scheduled for a leg amputation. Dr. Sanchez sees that his surgery team has already knocked the patient out and shaved his leg in preparation. He gets straight to work. Everything is going according to plan until the nurse checks the patient's files and starts to shake and cry. They were in the middle of the operation to remove the wrong leg. At that point, the procedure had gone too far and there was nothing they could do except for finishing the job. When Willie wakes up, he has one thing to say. "Doctor, that's the wrong leg," he tells them. Come to find, this is not Dr. Sanchez's first mistake with amputations, and it's far from University Community Hospital's first mistake overall. At a different hospital, he had removed a woman's toe without her permission. This most recent mistake with Willie's leg cost him his medical license. As for the University Community Hospital, they had their support from the state taken away, leaving them unable to receive funding. This was their third major mistake in a short period of time. Before Dr. Sanchez, another doctor had tied a patient's fallopian tubes without her permission, and another doctor cost a 77-year-old man his life. Leo Alfonso was an elderly retired electrician who died after a doctor mistook him for another patient and removed his breathing tube. Leo had one arm paralyzed, and the other was held down by restraints. He was unable to signal for help as he slowly and silently choked. Number 8. Chemotherapy. Jennifer Rufer was 22 years old when she went to her doctor after she saw some bleeding and thought that she could have suffered a miscarriage. She was given a pregnancy test and it detected an increase in a special type of hormone. This was in 1998, and the testing technology wasn't nearly as good as it is now. At the time, her results could basically mean one of two things. 1, she might be pregnant, or 2, she might have a rare type of cancer. After ruling out pregnancy, the test was repeated over 40 times just to be sure, and each time the results came back positive for cancer. She was then taken to the University of Washington Hospital, where a man named Hisham Tamimi started her on an aggressive chemotherapy regimen. This toxic therapy damaged her internal organs and required the removal of her uterus and a large portion of her right lung. Imagine everyone's surprise when it turned out that Jennifer had no such cancer to begin with. As it turns out, she was essentially being pumped full of radiation and had to undergo multiple painful surgeries for absolutely no reason. She was awarded $15.5 million for her horrible and unnecessary suffering. Number 7. You had one job. Benjamin Horton was 47 when he went to the West Los Angeles, Virginia Medical Center because of his left testicle, which had become shriveled up and extremely painful. Doctors were afraid that it could have been cancerous and scheduled to have it removed before the potential cancer could spread. Dr. John Leppert was put in charge of the removal. Benjamin decided that, since the doctor was already poking around down there, then he might as well have him perform the vasectomy that he and his wife were always after too. It all seemed like a fairly routine amputation procedure that wasn't likely to go wrong. Dr. Leppert had been at the hospital for 5 years, so nobody could have foreseen just how badly the surgeon would ruin a very delicate surgery. It wasn't that the doctor necessarily performed the surgery incorrectly, at least not per se. The steps themselves were actually performed quite well, but the target was way off. Dr. Leppert, for whatever reason, had decided not to mark the surgical site before going forward with the operation. When Benjamin awoke, he found out that his healthy testicle had been removed. At first I thought it was a joke, Benjamin would later tell the Los Angeles Times. When it first happened though, all he could manage to ask them was, "What do I do now?" As if that weren't bad enough, Dr. Leppert performed the vasectomy on the testicle that should have been removed, damaging it even worse and causing even more intense pains that never end. There's now a $200,000 lawsuit against the hospital, and the case is still pending. As of 2014, Benjamin still had not had the correct one removed. He just does not trust hospitals enough to give them a second chance. Number 6. Mastectomy? How about a mastect to you? In 2007, a woman in Long Island, New York, needlessly had both of her breasts removed after a faulty lab test result mistakenly identified her as having a rare but aggressive form of cancer. By the time doctors realized that Derry Eason never had cancer, the 35-year-old woman had already undergone a painful 7.5-hour breast removal operation known as mastectomy. Her legal team believes that her healthy skin tissue may have been mislabeled as cancerous by a technician working at the CBL Path Lab in Rye Brook, New York. Years later, little information is available as to the case's outcome or if it even went to trial. Number 5. A little off the top. Dr. Paul Perito was 50 years old when he was operating on a patient who has since only been identified by the first name of Hank. Hank was a prison inmate who had somehow developed painful blisters on his groin that needed surgery to be removed. When Hank woke up from surgery, however, he found that more than just his blisters were now gone. According to Hank, Dr. Perito had first scooped all of the contaminated tissue out of his groin, then he packed it with bandages and stitched it back up. The stitches were supposed to be removed within a week, but it took them 3 times longer than that to finally get around to poor Hank again. When a new team of doctors looked at him, they couldn't believe what Dr. Perito had done. Hank's groin had changed to a dying color and was hardly recognizable. They pulled green, gooey medical packaging from inside of Hank's surgical wound. It smelled so bad it made the prison guard vomit. This started a long series of more medical surgeries to try and save Hank's manhood, each one with progressively worse results. Finally, Dr. Perito took another look months later and decided that nothing else could be done. He amputated Hank's member. The prisoner spent months handcuffed to a hospital bed until he finally finished his sentence and was released. He was 60 pounds lighter by the end of it all. Dr. Perito appears to have a criminal history that's just as interesting as any inmate's. According to witnesses, Dr. Perito is known to snort animal tranquilizers at strip clubs and has been charged with selling watered-down cancer and AIDS medicine on the side. Hank is currently suing Perito for what he has done to him. It's also worth pointing out that Perito had been sued for botching a surgery on another patient's genitals before. That case was settled out of court. Number 4. Gassy babies. Just last summer, the Bankstown Lidcombe Hospital in Australia managed to poison a newborn baby. We're devastated when their newborn son, John, died shortly after. Youssef shook his dead infant son and desperately told him to wake up. 1 week later, the grieving family gets a phone call from the hospital. The hospital admits that a nurse had inadvertently killed their newborn son after mistaking a gas of nitrous oxide for oxygen. Otherwise known as laughing gas, nitrous oxide can cause a rapid drop in blood pressure that causes fainting and heart attacks. When they hooked the tank up to the little babe's nostrils, that's exactly what happened. This same mistake injured one other newborn at the hospital as well. Number 3. Let's just blame the parents. That's what a hospital in New York decided to do after a series of mistakes led to the death of their 3-month-old baby, Lana. It all started when Sarah Keenan found her infant daughter face down in the crib, choking on her vomit. Astonishingly, the Keenans had invited a guest over who was an emergency medical technician, and he was able to use his training to get the child to breathe again. Still, they decided to call 911 and have Lana looked at anyway, just in case. And that's where their nightmare kicks into overdrive. The ambulance workers decide to skip over the 2 nearby hospitals and instead take it to the Bayshore Southside Hospital, which is considerably farther away. During this unnecessarily long ride, the infant receives no oxygen and they choose not to put a tube down her throat to keep her breathing. When she gets to the hospital, they give her a large mixture of drugs that includes propofol, the same medication that killed Michael Jackson. The medical staff notices that the drugs are making her blood pressure drop fast, so they decide to counteract the problem by giving her adrenaline. Only they mess up the IV and make things even worse. From there, it's another hour-long ambulance ride to the Cohen Children's Medical Center in Queens. It's become a true emergency at this point, but Sarah and her husband have been kept largely in the dark the entire time. They are in a complete panic and simply rush from hospital to hospital as told. They briefly meet with a doctor named Jamie Hoffman Rosenfeld. She tells them that she knows they have caused brain injuries by shaking the baby, and she accuses them of child abuse. They are taken away from Lana while she slowly dies. Meanwhile, their two other sons, ages 6 and 3, are taken from them by the state while the matter is looked into. Eventually, an autopsy reveals that Lana's brain injuries have nothing to do with being shaken. Dr. Jamie Hoffman Rosenfeld's observations were way off, and the Keenans are cleared of any wrongdoing. Many feel the doctor's accusations were made to intentionally cover up fatal mistakes that were made by her and by other hospitals. The Keenans have since had their children returned to them, and they are now suing the doctor along with many others. Number 2. A Changed Man. 10 years ago, a 77-year-old man named Sherman Sizemore was scheduled to have major surgery. He was a Baptist minister and a former coal miner, so with both a strong faith and a tough upbringing on his side, he felt ready to take on the procedure. Little did he know that these would soon become the worst moments in his entire life. First, the medical team gives Sherman a drug that renders him paralyzed. Next, they start operating on his gallbladder. Unfortunately, they skipped over one major step: the anesthesia. Over the next 16 minutes, Sherman feels every cut and stab as the surgical team digs deeper and deeper into the middle of his torso. He's completely conscious, yet unable to call out or even open his eyes, as impossibly sharp objects rip open his sternum just above the intestines. It feels like it will never end. Even after the surgeries, Sherman continued to be haunted by feelings of extreme terror and helplessness. It was the worst violation that he had ever been through, and it broke him as a person. A short time later, the minister put a gun in his mouth and pulled the trigger. Number 1. Rage-quitting surgery. In 2004, a surgeon in Romania named Naum Chiomu went crazy during the middle of a very stressful procedure. He needed to operate on a man's testicles and had to make an incision to get inside. His hand slips and he accidentally cuts through the 36-year-old man's urethra. No doubt most of you are already clutching yourselves and begging me to end the story there, and I really wish that I could. But what the surgeon does next is just too insane not to mention. Dr. Siomu becomes enraged by his own mistake and flies into a frenzy. He grabs a scalpel and cuts the patient's entire phallus off in one slice. Then he throws it on the table and cuts it into 3 more pieces before stomping out of the room. He leaves his shocked medical assistant struggling to keep the bleeding, freshly traumatized patient alive. The surgeon was ordered to pay almost $800,000 for this violent act and sentenced to 1 year in prison. Do you think this was enough? Or should he have been punished more? I'd love to hear your thoughts. Thank you very much for watching this quite gruesome episode of Top 15s. If you're interested in other horror stories, I just finished a really cool series called I Dared My Best Friend to Ruin My Life, and he's succeeding. Over 6 parts, totaling, I'm gonna go ahead and say about 3 hours. You can find the link to my channel in the description, and I will see you in another video soon.